Hi, my name is Stefanie Remson. I'm a family nurse practitioner and I also have RA. I am the CEO and founder of rheumatoid-arthritis-coach.com, and I'm going to talk to you today about navigating the US healthcare system. Navigating the healthcare system with insider's insight by me. About me, I'm Stefanie, also known as the Rheumatoid Arthritis Coach. I'm also a family nurse practitioner in the state of Nevada. I also have rheumatoid arthritis myself. These are my contacts if you'd like to reach me. I have no financial disclosures. This presentation is 100% voluntary and I have no financial gain being here today. This presentation was written for US-based medical care. I do not have experience or licensure in any other healthcare system outside of the US. This does not serve as medical treatment or recommendations and should be not used as such. Navigating the healthcare system can be frustrating, exhausting, and full of dead ends and rabbit holes. Having a chronic illness makes navigating the way even harder. Insider's insight. Before I show you the tips and tricks to making the most of your time, here is some insider's insight I would like to share with you from a professional's perspective. COVID-19. The COVID-19 pandemic has increased the burden of the healthcare system to meet the high demands of caring for these COVID-19 patients. This has forced most healthcare facilities to modify access to services, office space, and how services are delivered. These changes have further complicated navigating the healthcare system. It has also complicated working in the healthcare system, organizing the healthcare system, hiring healthcare physicians, and communicating within the healthcare system, among many other things. Everything involving the healthcare system is harder for everyone. Don't forget, healthcare workers get sick too. Just like your local fast food chain closing their dining room, trash not getting picked up, and schools closing due to staffing, healthcare struggles to staff positions too. Everyone from physicians to billers to the people who clean the office building and take out the trash gets sick. The entire world is short-staffed. Be kind to those who showed up today. A little perspective. Imagine if you owned a pizzeria. In January of 2020, you made 40 pizzas a day. You made ends meet, took home a decent profit, had to hire new staff about 3 times a year. March 2020, you had daily orders for 400 plus pizzas a day, and it continued for 2+ years with no end in sight. This doesn't make your health concerns any less valid, any less important, or any less urgent. You are important and we do get it. Moving on, back to navigating the healthcare system. Why do you want to be better at navigating the healthcare system? If you want something done right, do it yourself. When you know the ins and outs, you can usually save money. Everyone wants to save money. Saving money on a prescription, a copay, or even the gas to get there and back can help budgeting for chronic illness easier. People who are more active in their care usually report higher satisfaction. This means they're happier with the care they receive. Navigating the system efficiently can save you time. For example, if you know you need a study of some kind before a referral is done, you might be able to save an office visit. It's empowering to be in control. I'm a healthcare professional and I'm also an RA patient. I have some great tips for navigating the healthcare system. First, find a provider that's contracted with your insurance plan. Usually, you can start with calling your insurance and asking for a list of contracted providers. Then ask people for referrals based on this list. Going from referrals only can lead you to a lot of dead ends and starting relationships with people that are not on your plan. While you're already calling your health insurance for the in-network provider list, Ask them for their prescription formulary. This is the list that tells you exactly what medications are covered and at what tier or what cost. Usually there are 3 tiers, and this is how much they cost you out of pocket, with tier 1 typically being the cheapest. Bring this with you to your appointments. This way, your medical providers have options to choose from, and there's nothing unclear about what's covered and not covered. What do you do if your medications still aren't covered or are too expensive? Ask the medical office to do a prior authorization, also known as PA for short. Sometimes the medical office can do a simple application for you that can reduce the cost. You can also contact the drug company directly. There are many assistance programs for medications used to treat RA. Often they are lengthy applications, but they're worth it in the end. Once approved, they usually last for 12 months too. Ask the pharmacy staff for help. Sometimes they know about programs, applications, or coupons too. This is especially true for the smaller specialty pharmacies. Oftentimes, pharmacies will be very well versed in specific medications and even know more about drug coverage than anybody else on your team. Ask your rheumatologist's office if they have any advice for assistance. Often they have contacts for local pharmacies, big pharma, or contracts with distributors and might be able to help connect you with the right people. It never hurts to ask. Back to navigating the system. Sometimes getting something done is a matter of calling on the phone versus showing up in person versus getting the right person. If one way doesn't work, try the other. So many times patients will say, I called 5 times and nobody called me back, or I showed up and nobody helped me. Sometimes offices aren't set up the best for one way or the other. So just try them all. And if you do get a hold of somebody and maybe they can't help you, try again with a different person. Like I said, sometimes it's just a matter of getting the right person. Insanity is doing the same thing over and over and expecting different results, Albert Einstein. Don't keep trying to contact your office the same way and expecting different results. Always go into the relationship with the office and the staff with the anticipation that it's going to be long-term. Be respectful and be polite. You can catch more flies with honey than with vinegar. Kindness goes a long way, and so do manners. Whenever possible, complete the office or facility registration paperwork ahead of time. Most places offer it online or will give it to you ahead of time if you stop by. Bring any and all records you have early too. More on this later. More insider insight. Often there's a delay in scanning documents into the electronic health system. It's really helpful to give plenty of time for this necessary process. These are typically jobs that get the lowest priority. So these positions are often open and there might not be somebody to scan in medical records on the day you drop off. Face-to-face patients always get attention first. Wait times. Just book the appointment. Even if it's 3 months away, just book it. It's a lot easier to move up an appointment than to start from scratch or work a waiting list. You can call the office every day to ask for cancellations. You can also politely show up and wait in the waiting room. This one is key for rheumatology. Sometimes these offices get so busy and the staff gets so overburdened that they simply don't have the time to work a wait list that's on a pen and paper, or to call people to reschedule and sit on the phone for hours. So if you just call every day, very politely ask if there's any openings, there are always cancellations. It's just a matter of calling. Each patient's experience is different. Just because someone had a good experience with an office or a provider does not guarantee it'll be great for you. There are different needs, personality fits, and different priorities between patients. Get a referral. It doesn't matter if your insurance does or does not require it. A referral is how we communicate with each other and clarify exactly why you're seeing us. Usually there's even more information included on your referral, which can help us piece together all of your medical history and what we're seeing you for today. Every medical provider's training, experience, and comfort level is a little bit different. Try to be sensitive to that. Bring a friend with you. It always helps to have a second set of ears and eyes at your appointments. Your spouse, friend, or family member might have different questions to ask too. Most importantly, always bring a friend if you're having a procedure of any kind. You really never know how you're going to tolerate it. I can't tell you how many times people tell me that they will be fine and end up passing out during a procedure. Let's talk about second opinions. When requesting a second opinion, be open and upfront right away. Not being upfront and seeking the same treatment from similar medical professionals is a form of insurance fraud, and this is not taken lightly, more so with Medicare and Medicaid. Think of a second opinion as a date. You're basically saying, I'm currently in a relationship, but I want to see what you have to offer in case I want to leave my current relationship. That's a lot of pressure. Keep that in mind when seeking a second opinion. Be clear on what you want a second opinion on too. For example, you may want an alternate medication option, alternate treatments that don't involve medications. You may want to confirm or deny a diagnosis, or maybe you are trying to conceive or are currently pregnant. Bring all of your records from all previous providers with you too. This includes office notes, labs, imaging, which includes X-ray, CT, MRI, ultrasound, and prescription history. Remember, the grass is not always greener on the other side. The grass is greener where you water it. Sometimes a second opinion is needed. Other times we just need to reinvest in the relationship we're already in. Back to navigating the system. Take notes at your appointments. Sometimes we need time to process and recollect our thoughts before asking questions. If you're going to record your visit, please let them know. Also, a side note, if there was a word or something that maybe you didn't understand and you know it's something that you're going to want to read about later, you can always ask somebody to write it down for you. We're happy to do that. Immunization records have become so important in the last 12 months, even 2 or 3 years. Keep a copy of yours handy. Be sure you're registered with your local county or state vaccination tracking system. If you don't know what this is, your medical team, pharmacy, or a quick Google search can help. Part of navigating the healthcare system is keeping yourself organized as a patient. Make your own personal health record, also known as PHR. What is a PHR? This is where you collect and organize all notes, labs, imaging, including X-ray, CAT scan, MRI, ultrasound, etc., and hospitalizations in one document. I recommend this to both be printed and electronic. Sharing is tricky when it comes to healthcare and privacy laws. This is why I always recommend both. Some facilities will have access to electronic sharing and some won't. This is helpful to all of your providers, but also essential in an emergency. When making a PHR, start with your health insurance company. Many insurance companies offer a platform that can store everything in one place. If they don't, there are many for purchase in the App Store and through larger medical research universities. There's always Google Drive, free scanning apps, and old-fashioned PDFs too. Your PHR should include, this is a great time to take a screenshot. Number 1, your full name, address, and contact information. Next, emergency contacts, ideally with several backup phone numbers and contacts. Next should be your medical power of attorney. Next should be all of your healthcare providers, including your dentist, ophthalmologist, and plastic surgeons. Yes, you should even list where you get Botox or Dysport. Next, you should include your health insurance info, including photos of the card front and back if possible. Next should be all of your medications, dosages, and the pharmacy you use. If you don't have this on hand, or maybe you don't have the time to write everything down, there are two great things I recommend for this. First of all, you can take photos of all of your prescriptions and then put them in a file in your photo app. Next, you can actually go to your pharmacy and ask for a printout. They can usually provide up to 2 years of all prescriptions filled. Next, on number 7, allergies, including medications, food, and environmental. With your allergies, it's always great to include what the allergy was, whether you had a rash, anaphylaxis, or maybe you're allergic to cantaloupe, but you can eat a little bit and it doesn't really bother you. That should all be listed. Number 8, family history. 9, surgical history. If you've had any surgeries at all, list them here. If you have dates and surgeons' names, that's also very helpful. Next, you should include all pertinent medical notes, including hospital admission, consultations, and discharge summaries, as well as all specialty notes and in-office testing done. Next should be your immunization records. Next, you can include dates of your last eye exam, dental exam, and any other outside records. So if you saw any other specialist in the last 1 or 2 years, list it here. If you have records or information available, that's great. If you don't, you can just list the contact's name and phone number. Next, include all of the labs you've had done and where they were done. Many cities have multiple labs, and even for one person, sometimes we have to use multiple labs. So please list what lab your specimens were sent to. So I'm Stefanie. Like I said, I'm a rheumatoid arthritis coach. And when you coach one-on-one with me, you get a whole lot. Help navigating the healthcare system, which I just talked to you about today, medical records translation, so you can understand them. I can help manage your healthcare team, personalized education about your diagnosis, helpful tips about RA medication, better flare management through symptom tracking and interpretation, guidance for an anti-inflammatory diet, exercising with RA, intimacy with RA, parenting with RA, and support for talking with your family and other loved ones about RA. Lastly, you get the amazing mindset work that I provide, which is by far the most popular and requested work that I do. Thank you so much for having me. Again, here is all of my contact information. Feel free to reach out, and I look forward to chatting with you.